Okay.
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 So the hard part about this diagnosis is there's really no easy answer to that question. Okay. You are absolutely going to have an altered quality of life. Unfortunately, I wish I could tell you it would just melt away and leave you completely intact and everything would go back to being normal. And, that's what we want. As a physician, I would love that. It just does not happen with this type of treatment. That's the problem. The problem is the head and neck is full of mucosal membranes. So when I showed you that picture, all this pink stuff, and even when you just look inside your throat yourself when you're brushing your teeth, you'll see all of these mucosal membranes are in the radiation field. That's the problem. Okay? Essentially from your pillar of your tonsil, which is over here, which tracks then in your case back like this to your tongue. So you have to cover all of this area. The tongue itself can have tumor on one side but start to spread to the other side of the tongue. This is what we've learned with experience. So you can't just treat that. You have to treat that plus the other side of the base of tongue. And then when you do that, you start treating this airway area here, And then you have to treat the lymph nodes. That lump in your neck there, those are lymph nodes. Yeah. And that's what these are here. That's what this kind of depicts. So it starts in your tongue, spreads to the lymph nodes, and then what's going to happen is, if you don't do anything, it's just going to keep marching down the chain, and then it goes below the neck, what we call below the clavicles. And when that happens, then we can't cure you. That's what we want to make sure hasn't happened. That's why we ordered a PET CT to see if there's any active cells on the scan that are in different areas or below your clavicle and things like that. That's the problem. But as you can tell, I've got to treat here, the tongue, and all the way down the neck to cover the areas that we see plus areas that we don't see that are at risk. And when you end up doing that in the head and neck, you end up getting a lot of those tissues in the way. And there's just, unfortunately, no way around it. We used to have really, really bad, horrible side effects because we didn't have the technology to kind of paint the dose where we want to put it. And they would literally send a beam of radiation in from this side and a beam of radiation in from this side, 2 fields, blast through and through to cover everything, and that's it. Now we use 9 different fields of radiation, what we call arcing, IMRT, IGRT, you probably heard about all this stuff. And that allows you to shape the dose of radiation a little bit better so that you can pull the hot spots away from the carotids and away from the parotid glands and things like that. But radiation is still radiation. The beams that we aren't able to do that to because we have to cover those regions are still going to get the high dose of radiation. So we have seen better side effect profiles than we used to in the past, but you still notice the symptoms during the treatment. You still get the pain and all that down the feet.
I'm not worried about the pain. I'm not worried about the swelling. I'm not worried about... I'm sure I can handle the side effects. My problem is
the after effect.
6 months down the road, am I still going to be able to drink and eat? I mean, even if I don't even taste the food, I just want to be able to talk and swallow. Without having difficulty.
It will be different. It depends on how you scar. Some people, the tumor does shrink away very softly and very nicely, and others, you get more of a scar formation. So it just becomes more fibrotic, is what we call it. Okay, and so it will be harder to swallow. Now you can do, there are actually speech therapists and swallowing things that you can do to try and overcome that. It's very important during the radiation, despite the absolute desire not to actually keep eating and swallowing, because you use those muscles and stretch those muscles. And a lot of our older patients that we treat, you're young for what you have. A lot of our older patients that we treat, heavy smokers, sometimes drinkers, all that, as soon as they get this poor taste in the mouth and all the phlegm and mucus, the last thing on earth they do is eat. And they just say, well, I know I gotta eat, but they just don't eat. They'd rather just not eat. And that's the problem. You don't use those muscles, and now you've had months and months and months where all you're doing is just swallowing saliva, and you need a bolus of food in there to stretch.
Keep expanding it.
And now they get the scarring effect of the radiation, and then that's when they can't swallow very well.
Well, and you're going to supply me with the swish and swallow stuff and everything that will help me. I will swallow stuff, because I know it's going to get tender in there.
Right.
I mean, up until this point, I've had it for 2 years. I mean, nothing has changed in the last year and a half. My swallowing has actually improved. I believe my airway, or wherever it's swallowing through, is I swallow fine. I can swallow solid foods, breads, pizza.
Right.
I eat mostly salads now. I've changed my diet so I can get off my high blood pressure medication.
Sure.
And there's a lot of stuff I've changed in my life the last year and a half of figuring out that there was something in my throat, and then I wasn't diagnosed with it until last December. So,
but what happens, let me tell you what happens naturally. These things basically grow, and sometimes they grow slowly, and then sometimes we'll have people in here who say, overnight, this huge thing just popped up in my neck. I mean, everybody's a little different.
yeah.
But a cancer or a tumor, it's really unchecked growth. It keeps growing eventually. Yours is growing slowly compared to that, I agree. But it's still growing, and it's moving to your lymph nodes, and then it's going to start spreading to other lymph nodes, and then it may spread to your lungs, and all those other things. And that's the problem. If it starts doing that, we can't cure you.